Hey guys, and welcome back to the Healing Your Way podcast. What's up Wednesdays? Professionals of the Roundtable, and just recapping from last week. We had my mother on, Mito Patel, and Dr. Danny Coyne on last Wednesday's episode, and we kind of got their perspective on COVID, what they thought about it, how you should go about doing things for yourself that can help you prevent getting it, and all of those good things. And now today, I have Dr. Danny Coyne with me from last episode, and now I also have our acupuncturist Marvin here as well. Can you guys say hello and just reintroduce yourselves real quick?
Good
All right.
evening, everybody. This is Dr. Danny Coyne, the acupuncture and Oriental medicine expertise. And I was here already. Probably you guys know all that. So pass it on to Marvin.
Hi, my name is Marvin. I'm also an acupuncturist at Healing Your Way. I think you guys remember me from the previous podcast, and glad to be here.
Yep. Thank you guys for coming today. And before we get started, real quick, I just want to plug our socials real quick. If you guys don't know, besides here on Rumble, we are also on YouTube, Facebook, and Instagram, and the handle is at Healing Your Way. And I highly suggest you follow, like, and check out all of those channels because it really means a lot to us, especially the more you like, the more you follow, the more you share it. This podcast it can be seen to more people, and we can constantly be giving you the best content we can possibly give you. So please share it with whoever you think would be interested in health topics and holistic health like this, especially with all the professionals we have on from our team. And yeah, I just want to say thank you guys so much for tuning in. And yeah, without further ado, today the topic is going to be focused more around pain management and acupuncture's sort of perspective on it. So I guess my first question to start off is how does acupuncture see pain management? Do acupuncturists see pain management differently than Western medicine approaches it, than a physical therapist approaches it? What makes acupuncture's perspective on pain management different, or is it similar?
Okay. Acupuncture is based on a pain management happen when the flow of energy, life force, that's what they say. We focus at the life force that are being blocked or imbalances along the meridian. Acupuncture unblock it, balances this flow. So it works very closely by stimulating nerves, muscle, connective tissue, and boost natural painkiller like endorphin and serotonin by inserting a really fine needle onto a specific acupoint.
And as far as patients, do you see a lot of patients for pain management? Is it something common for an acupuncturist to see?
Marvin?
Yeah, I can. I'm mostly specialized in sports medicine, so I do see a lot of patients coming in for a lot of pain. For example, like a lot of like tight muscles, like
Hip pain, neck stiffness and tightness,
low
along
back,
with, yeah.
you name it. So our job, we mostly help release the tight muscle, calm that inflammation, helps that improve that blood flow, and also reduce the pain. And it really goes deep. I really try to combine with Eastern medicine and also Western medicine to help reduce the pain.
Got it. And well, I guess this is kind of a personal question, but from what I've seen with Western medicine, usually a lot of people are prescribed painkillers, and some form of medication to alleviate their symptoms of pain. Um, and these symptoms may vary from very excruciating pain to, like a simple headache. Um, are you against pain medications? And do you think someone who is currently on pain medications can experience a lot of benefit from seeing an acupuncturist?
So pain management into medication, there's a variety of that perspective. Yes, when you need it, uh, you need it, you have to take it. For a long-term perspective, can affecting our bodies in many harm ways. So digestive issue, addiction, and all this system can be the another issue that they can bring on to themselves. Where acupuncture, there's no addiction. It just makes you feel better, and like I said, it activates the nerve, calm the nerve, relax the muscle, help heal the connective tissue. It also boosts the endorphin and serotonin as itself without dependent to the medication itself. Yes, people using medication should be mindful that what are the side effects, what are their withdrawal effects that you bring on to themselves. And from that perspective, I would say be mindful, try alternative. We're considering this here alternative actually exists for thousands of years. The use is also a primary. You could look at that perspective as well. And what's your thought with your kinesiology in that direction?
Yeah, so from a kinesiology standpoint, we while kinesiology does not replace medication, it can definitely like reduce like the reliance on like painkillers by addressing like the underlying like the movements problems that kind of cause or worsen the pain. So I think by improving like strength and flexibility and also like the posture too, it will help like many clients find like no longer need those everyday like medication or require it like occasionally, you know.
Got it. And
So
I think that's something that's super important because, of course, medication is costly, and it's something recurring. Like I see that medication only treats things that are symptomatic and not really the root cause of
Just
the pain.
masking the condition.
Yeah, exactly. So how does acupuncture kind of directly target? How do you, as a practitioner, um, find ways to target the source, or how do you locate the source when you're dealing with someone with pain management?
So when a person walk into my office or my clinics, I would want to know everything, whether they have MRI done, X-ray done, what have they tried or approach to the treatment of the condition itself. A lot of folks they come to us with the last thing on the list, like oh before surgery they would say let me try acupuncture first, or the medication no longer uh, helping them. So by assessing if they have all those documentation that are supporting the cause or the issue. For example, knee pain. We look at knee pain as a focal point. Not every knee point is the problem. So knee point could be inflammatory. It's from uh, falling, damaging meniscus, or bone on this thing. Depend on the category of the patient, also age, all this thing. If someone say I just have a trip and my knees start to have pain, mostly we assess from the hip down or possibly from the lower back down to the lower extremity. So that can play a major role. We say there's a term called, this is just an example of knee issue. Okay, it could be multiple things, but when we assess, it could be, like I said, from the hip issue can affecting the limbs itself. So we narrow it down to see whether that is the cause. then we treat based on we call it the flow of the meridian. What meridian being affected? There's acupoint. Acupoint, that's where we say when needle insert into that particular acupoint, it creates flow of energy, of vital energy, where we thought when the energy flow causes the blood to circulate, pain start to reduce. Histamine start to come off from that binding site that causes the pain, or from the stagnation of the blood itself. When the blood flow, pains reduce as well. So let me mention a little bit. Me and Marvin discussed of like he brought in. Yes, I'll be talking about from the acupuncture perspective. Since he's an expert in kinesiology, I want him to talk about that as a beneficial factor to with acupuncture conjunction with kinesiology or sport type of medicine technique that benefit. Since he's the expert, I would say he bring on, suggest that what would you say in terms of someone this type of issue?
Mm-hmm.
Yeah, definitely
So
the two fields are
kinesiology,
very. Oh, sorry.
yeah.
No, go ahead.
So we both have different perspective, but we do work together as a team to create a good healing for these patients. So kinesiology, we treat pain by looking at the whole body, just like acupuncturists. So we kind of like look for like the structure, the movement, and sometimes like the internal, like the stress of ourselves, by correcting like what's the root problem, instead of like focusing on just the symptoms itself. So we do a lot of range of motion. You see which part might be tight, or which part might be weak or strong. So we try to compare both sides of the muscle to see um, which part needs to focus more on.
So
So
basically, the
yeah.
mechanical movement of the body structure itself, from
Mhm.
a deficiency to a strong, a strengthy muscle, or
Mhm.
the structure itself.
Yeah. So let's say, for example, let's say low back pain. Low back pain is the most common issue that many clients come in for. So we try to like see what certain muscle is weak, um, either like the glutes or maybe the core, or we can also check like other muscles that is like doing too much, like say like your hip flexors or your low back is doing a lot of work compared to the other muscles. We
So you're
also
like
check like
overcompensating in like certain muscles, and then that is a
yeah,
sign for another issue.
yes, hmm yeah. We also check for the posture. Is this person bent forward, or this person is leaned more back? So we kind of like palpate certain muscles. Let's say like we would like check the pelvis, see if it's tilted, or we also check like the shoulders if it can have an effect for your lower back. And also we also check for movements as well. So like we would give them like certain movements such as like walking, bending forwards, or just lifting an object up from the floor, to see which parts we can focus on, analyze which part is the issue.
Got it. And are you using any like special equipment when you're conducting these sort of assessments? Like, I'm not sure any of the like specific terms for the equipment, but like, is there anything you use, or are you just conducting like a visual assessment?
I'm more of a perspective, visual person. So we would do like different muscle testing on my patients. Either just bring their leg up, see how far it can reach, how far it can reach up. Maybe let's say this person's leg is weak. Their leg position can be a bit minimal. It can cause pain. If this person other leg is stronger, you can lift up the leg normally compared to the other one. So we can help pinpoint which part um, that needs to be treated. Um, like besides that, we also do a lot of like just with muscle testing. We do, like use different tools, like um,
Something in and out. Marvin, is your speakers okay? Oh, the microphone. Is it? Are you away from your microphone?
It's just going a little bit in and out.
It was
Can you try turning your mic off and then turning it back on again?
all right. Let me see.
okay.
And then talk.
Can you hear me now?
Yeah,
Yeah.
I think just lean a little yeah, a little closer because sometimes if you're too far back, it's not picking.
In and out, in and out. The scope of the
Okay.
voice.
But it's okay. Yep.
Mhm. Yeah, so I do
So-
mostly a lot of visual, like analysts. So I kind of like analyze the person's body movement to see which part is weaker, which part is stronger.
So
Got it.
basically, after you assess this, you found out, do you treat with acupuncture as well? Or do the strengthening first, or engage with the two, kinesiology, strengthening plus acupuncture treatment, right?
hmm So we do a lot of both. We also do a little bit of like massages on certain muscles just to help uh, relieve that stress in that specific region. On Besides that, we can also use acupuncture to uh, help reduce um, the tightness of that specific region. This will help like get every muscle just to wake it up from the tension and just get everything moving. You know.
Okay, got it. And as far as like a time frame for someone coming into the clinic, I guess I'll get this from both perspectives. Say, for example, someone's coming in with mild to a little bit more like mild, but a little bit more than just mild, like between mild and severe. Like say someone who's coming in at a
At the
point like
twos,
that.
from a 1 to 10, you try and say at a pain of a 2.
Let's put it like this. Say if it's from a 1 through 10, someone's coming into the clinic at a 6. Um, with a given, can you give me like a time frame of like how fast you can bring that 6 down to maybe a 2 or even a 1 or even 0? Like how long and how many treatments does it take, I guess, from each perspective, from an acupuncturist perspective and also as a kinesiologist when you're seeing people? How long do you usually have them in? How many times do you have them in before they're ready to go?
So from acupuncture perspective, I would have to say it's depend on what that type of a pain of a 6 is. Meaning, 5 would be the meat in the middle of the thresholds. 10 would be the most painful. 6 still considering as high pain. Uh, I'll just give you an example.
Yeah, can you give an example of
One.
like a 10 and a 1?
Yeah. One from after each treatment, dependent to remember, there are a number of people that respond to acupuncture differently. I would say within 2 sessions, if a person respond to acupuncture, uh, some folks would say right after the treatment they will be able to feel less pain but more soreness. So uh, some folk would say drop to a 2, walk normal, walk in with a cane, walk out without a cane. Can be crazy like that, but without this is a dramatic change. Some folks, yes, they take. Remember, it's osteoarthritis, rheumatoid arthritis, myalgia related to something that super chronic. You might not feel the effects right away. after, I usually the next morning, it can be either sore or pain reduced to a 2 or a 3. But remember, reduce first. After 3 or 4 days, pain start to come back again, and it might be going back to a 6. The person would say, "Oh, the pain is worse than before." But when the pain dropped to a 2 and jump back to a 6, that's a total changes. And misconception, people can think that way. Yes, I would say from a 6, it could be to a 2, to a 3, to a 4. Some people to a 1. One notch make it different, right? So it's dependent to the condition.
Got it. And Marvin, I guess from like the kinesiologist perspective, I know you're more involved with just directly like the musculoskeletal system. And I don't know how related it is to PT, but do you focus more on like strengthening and with exercises after implementing some of those massage and acupuncture techniques in order to help with the pain?
Yeah, so we try to. It's a good combination with acupuncture and also rehabilitation, whether it's physical therapy or chiropractor. We try to like assess level, what's going on. Like Dr. Danny said, it really depends on the condition. We try to see the full, give them the full assessment, um, what needs to be tested and what needs analyzed. So our focus kind of like see what needs to be targeted. Like for example, if for low back pain, what needs to be activate weak muscle, and also like giving them the correct exercises they need to be trained. Like they give them stretches to help um, relax that certain muscle. Giving them exercises back in, give them a cobra stretch.
Marvin, one second. Sorry to cut you off. I think the music playing from the clinic is what's like drowning out your voice a bit. Can you pause it?
Let's go ahead.
Okay. Can you?
Sorry, everybody.
Yeah, sorry to cut you off, but go ahead. Continue with whatever.
Okay. Yeah. So basically, we try to retest like the muscle and try to track the pain if it changes for that specific condition. And we also try to add like different exercise to help bring back the strength and also the stability of that certain muscle. So we try. So we do like different types of movements, such as squatting, maybe bending, different ways of sitting, and we try to give like different modalities to help different lifestyle exercises to help reduce the pain and also reduce the stress that causing it.
Got it.
So definitely the along with that, acupuncture is the asset to this recovery as well, right?
Yeah, and we got or a couple questions from the chat. They're both related. One of them says, "My mom used to get injections to sort of turn off or numb the nerves in her knees due to chronic pain." This person's asking if acupuncture would be a good alternative to having those injections.
Well, when there's not much to, if someone walk in with cortisone shot or epidural shot to reduce the pain in that lower back or hip whatsoever, yeah, sometimes it work wonders, depend on the how severely of the stenosis or blockages. and we call this is masking the root of the condition, right? Maybe impeded or preventing bone being pinched together that opened the door for to stop the pain. It can last people from they require probably 3 injection, most of the cortisone shot. Uh, After that, you're gonna look for alternative. But for me, it's really unsafe sometimes to get all those weight gaining, arthritic future on hip issue. Acupuncture definitely, again, it's not a magic pilot where you go in and get acupuncture. It suddenly it cure you. It requires some time, and sometimes the assessment between treatments also will tell us what direction actually where the problem is coming from. A lot of folks confused. They said, "Oh, I have a hip pain." Like hip pain can be multiple factor, and instead of treating the hip flexor itself, it might be coming from the lower back area where the nerve crisscross. So again, yes, it can be beneficial. So I always say, give it a shot. 2 sessions. If you come to my clinic, you will know whether it's going to be helpful or not.
Yeah, and I think that's a really good thing to know too, because some people end up investing multiple sessions, way beyond just 2 sessions, and they stick around for these rehab programs or pain management, or clinics that deal with pain management, and they end up staying there for prolonged amounts of time, spending all this money, and yet by the end of it, they're promised no more pain, but they're still walking out with, a limp or all those problems. So I think
Yes,
I
it's
think it's really
also
good for someone to have have that kind of
mindset.
safe mindset and safe mindset going into a clinic and being like, I can be fixed in 2 sessions, or if 2 sessions it doesn't work, then maybe I can move on to the next remedy.
Next expert to you, next specialist. Remember, every expert, every acupuncturist, every doctor or practitioner has their own expertise. Usually for me, I said within 2 sessions, I'm going to try my best to see how it going to turn out, but doesn't mean that I'm going to fix within 2 sessions. The idea behind pain management is that does each session reduce or help my pain reduced to a certain level, noticeable for me to continue to be able to recover from this. That's the goal. If you say some people will say 4 sessions. Oh, I'm going to give 4 sessions. Yes, 4 sessions even better than 2 sessions. So now the time frame within those small window, you able to feel better. That's where the point is. See if any changes within 2 sessions. Does it regress? Does it stay the same or nothing touch it? So that the fine line, but not to cure it. So you need some more time for this type of treatment. So it could be a what do you call a regular tune-up after 4 or 5 sessions or 6 sessions. Now your condition might be severe that a month or 2 months from now you might need come in to tune it up. This is where we address to the patient that look, we cannot cure it 100%, but if I can take a pain to a 2, that's we can live with it.
Yeah, bringing the pain back to a much more tolerable state is like can mean the world to so many people, especially if their pain is on the more severe end, say like the 8 to 10 range. It can be a lot bringing something so severe all the way to 2. So they're still able to function way better than they were in the condition before. Maybe there's still a little bit issues, but they can always come back for, like you said, a tune-up or further treatment to try to minimize it as much as possible. And yeah, we have another question from the chat. Um, one person asked, how important is posture when it comes to muscle issues or pain regarding muscles?
I mean, posture is really important. Like it's been causing a lot of like health issues. Sometimes it's better to just keep your posture straight as much as you can. Not many people can are aware of how they're sitting. Posture is like. It's just you need. It's something we have to like remind ourselves like every day that you try not to look at our screen all the time and just bring your back nice and tall and do some stretches to help flex the back area. Yes, I mean nowadays people are constantly going on their phones, keeping their head down, causing a lot of like neck pain and also tension in the shoulders, bring their shoulders inward, which can cause a lot of stress to the spine, to the muscles, and also it can push a lot of pressure on the nerves too, and can cause many different pain conditions, whether it's sciatica or low back pain or knee pain, especially. Um, so it's best to do some like home exercises um, with the with an addition to acupuncture to help. Uh, it's what is it to address those imbalances, and that contributes to that kind of pain.
Okay. For my perspectives, also, and we working in a setting where everybody on the computer, we say 2020. It's more like look up straight for 20 minutes, move your head left and right, and also it's good to have two screen. You can never fix yourself in one screen because uh, also have economic type of chair where you can move up and down every 30 or 40 minutes. So mindful of that setting and adjustment. Economic type of setting is important. Take some time off, 1 hour, maybe get up and have to go bathroom or have a drink of water just to give yourself an excuses. It's proper erection of your upper body. It's be mindful, prevent, especially someone like Marvin said, if you reading a phone from a small tablet, your head is bending. What happened? Your head is the weight is around 10 to 12 pounds. If the degree of bending depend on how long you are erecting it or bending it, the weight start to increase. 12, 10 become 30, 40, up to 90 pounds. Because your head become, your muscle cannot hold that because the gravity start to pull. So keep in mind that your posture is the proper way to, even sitting, prolonged sitting cause lower back pain, trigger sciatica, trigger circulatory system, cause pain in the feet. So all this thing, yeah, mindful stretches, exercise, eat well, sleep well, rest well, and do some meditation to alleviate some stress. So that definitely will help a lot to take all the tension from the neck, shoulder, down to the lower extremity and the body.
And as far as posture, someone asked another question to build off of this. They said that posture correctors are big on the market now, and do you guys as practitioners see any benefit to them? Do you think they're just gimmicks, or do you think they can really help people on the daily try to fix their posture and try to do better for themselves? Like, say for example, like this chair is like a ergonomic chair. I guess that would kind of fall under the
Yeah.
category of posture correctors. Do you think something like this is like worth the investment to have in a setting, especially for someone working on the computer all day?
I totally agree. From my perspective, is that if you leaning, for instance, hunch over for a long period of time, eventually you develop that curvature of your lumbar issue. In order to correct that again, there are shoulder posture, upper body posture correction, and not immediately. You can use it, but lightly tightening it, because you put it on first time, it's gonna hurt you because the posture is already off or incorrect to begin with. With those extra support, it will readjust you to a normal state, but it takes some time. Yes, it's not a gimmick. It definitely will help when someone really need to correct that posture. So, from my perspective, I have seen a lot of patients. I refer them to purchase all these, especially upper body, neck, shoulder, posture area. Yes, highly recommended economic type of chair where you can stand, where you can sit down. Uh,
Got it.
Yeah,
And
yeah, yeah.
did you have anything to add, Marvin?
Yeah, I mean, nowadays people are making a um, lot of like tools and foams, rollers. They all been helping a lot with people who are having issues. Like for example, like pillows. They're making different shapes to help give them support, whether it's the neck or the back. But yeah, definitely check um, research different conditions and what like equipments would help um, support that specific pain.
Got it. Thank you. And I have kind of a personal question about posture. I noticed that before when I saw, like correct, I saw images or diagrams of like the correct posture to hold. I would try to like emulate it and try to fix myself into the position that was shown on the diagram. But I kind of had trouble, and that position of like perfect posture kind of felt uncomfortable to me, and I didn't really focus on it or care about it too much. But then I started doing weightlifting, and something I noticed, especially, was that strengthening my back actually brought my chest up and kind of made my shoulders retract and be in the correct position to be comfortable while also being upright. So my question kind of is how important do you think strengthening is for posture? Because before, like I said, I tried to hold correct posture, like people were telling me to, because they were making comments or whatever about my ugly looking posture. But then when I started weightlifting and especially doing movements like rowing movements or pulling movements, I really felt my shoulders kind of go back and down, and this position doesn't feel as uncomfortable, and actually feels a more natural position compared to the slouch, the slouch kind of position I was doing before.
well, what you stated is correct. When you uh, get used to a un favorable position, but for you start your our body lean toward it, accepting how you uh, uh, sitting or standing, leaning forward make you feel more comfortable. Remember, trying to change from incorrect posture to correct posture is very uncomfortable. Just like when I said put a brace on the upper body to align the shoulder and the neck itself, or the upper body, at the beginning of time, it's very uncomfortable, unpleasant, because remember your body already fearing the incorrect form. Bring it back to the correct form, it takes some time. That's why when you do the weight, you actually strengthening it. It gets stronger. Once it falls back to the original state, you you're gonna feel perfectly square to your body, to your feet. We call the Tai Chi position. If you can erect your body just like a Tai Chi position, length of feet and leg square to your shoulder, that perfect erection. So that's a good posture.
Got
So
it.
keep in mind, when incorrect posture develop, bringing back takes a lot longer for it to be correct.
And do you suggest people first start doing corrective exercises, or say if someone has pain while also holding correct posture, would you recommend that they see an acupuncturist to alleviate the pain first, and then start looking towards things like for strengthening and that lead to correct posture? Or would you, like, you know what I mean? Would you deal with the pain first and then implement the strengthening for corrective posture? Or would you just go into corrective posture exercises like right away?
No, sorry. Well, I'm going to take this one, and you can take the
Yeah,
kinesiology
I'll take
perspective.
this.
So from
I'll
this
take
perspective, when someone has a muscle issue, right? Now the posture is misaligned, or the upper body, upper neck posture already incorrected. For instance, if you go into chiropractic adjustment, usually you can adjust, but it will go back to what it was incorrectly. So what I normally suggest is that either getting loosening with massage, following, or with acupuncture, and then get adjusted. Once your muscle and ligament and tendon are loosening up, you can recorrect by adjusting it. Now, exercise, strengthening, PT, kinesiology will make it stronger. But if you go just go straight to PT, or believe it or not, I've seen it. So if you go straight to kinesiology or PT without touching that area to break it up or loosen it up, definitely going to be very painful. It's not simple; it's just painful. But once you help loosen it up, and then adjust it, correct the subluxation of the posture of the spine or any part of the body, and then strengthening it, then you're in good shape. Don't you agree, Marlon?
Yeah. So basically, strengthening is very important for a good posture, because like your muscles are actually trying to hold you up like every single day, you know? Not just like your bones, but everything. I mean, if if say your muscles, like your core, your glutes, and like your upper back, they're all if those are weak, your body start to um, like like slump down, or your posture just won't get straight, and it will cause like aches and pains. So strengthening those areas can give the body a lot of good support. It helps keep it nice, stay upright, and try to get everything together like without any strains or pains. It's all about training your body, but also training your mind, to move and just to hold itself like a lot better.
Mhm.
Just without trying not to think all the time, but just always keep it mindful, and repeat every single time. It'll become a habit, and it'll eventually heal itself naturally.
Got it. And I kind of want to go more in the direction of sports and athletes. So as far as pain management for athletes, I kind of want to ask for sports where um, the athletes have like little recovery time. So for example, like hockey, I know they play tons of games. Their frequency is very high when it comes to being active. Soccer players, they play. I think they play 90 minutes, and I'm not sure if any other sport goes to that duration for their games. So when we're talking about these long, extensive hours of training and having games, how does how do you kind of fit acupuncture into the pain remedy and also the recovery of the athlete? Like, um, will acupuncture like inhibit the athlete from being able to fully recover due to some of the soreness it gives, or like how do you kind of navigate that? Is what I'm trying to say.
So from my experience, I work for the Philadelphia Flyers for consult them for almost 15 years. So usually I help those folks. The way to approach this is that after the game they all feel beat up, yeah, all the muscle ache and pain, but they have tension, might lost range of motion at the hip level, elbow level, or forearm. So what I normally do is to ask them how much pain can they take, what is their general recovery after getting some sort of treatment done. Usually, the athlete themselves tell like, "Hey, let's do lightly." So in you cannot be aggressively treating uh, by rapid release scar tissue, release trigger point. These are really strong point, but you can get a muscle twitch and let it go. So they will be able to go back and play again. But if you keep on stimulating too much, that will create that soreness. It take a sometime 12 hour to 24 hour for the soreness to go away. So yes, gently approach that. Depend on how the individual or patient respond to that treatment. Some folks you can treat as aggressively as you can, and they be recovered and ready for the game time.
Got it. And I guess treating more aggressively and more with the rapid release stem would be more suited, I guess, for amateur athletes who are not on like a professional schedule. Like like for example, the Flyers. The Flyers have and this game to attend, and they have to, otherwise they'll be benched and all other sorts of things. So I guess what you're saying is you kind of approach treating them with the rapid release technique more gently, and you're not really scraping too much scar tissue, but you're still doing enough just to be effective, and so they can recover for whatever the next activity or training session or game that they're going into.
Correct. That's the approach. Generally, that should be the approach for pretty much amateur or not. It's defined by individual. Some folks they like that aggressive, but they come back in no time, and they don't have the issue with soreness or tightness along with that. So you just touch base based on that. So
And can you talk a little bit about the rapid release technique, what you use it for, how does it work, and I guess how effective has it been for you? I know you just mentioned it a little bit, and then also on top of the explaining rapid release, can you also kind of talk about what you mean by aggressive treatment? Because sometimes people can be scared of like using the term aggressive, like especially when it comes to needles. Because I know when I've worked in the clinic at the front, there's some people would say it's their first time. They sometimes have even expressed to me their sort of I don't know, I guess them
scared.
being scared
Okay.
of coming to the treatment because of the fact that you're using needles to do the treatment.
So it's aggressive treatment, meaning when you insert a needle into the belly of the injured muscle, usually muscle twitches. If excuse me, if you repeat it, the twitching multiple times, that can be intensely painful. That's aggressive. That means the way the needle stimulated should be not too fast, not too strong, and you get one or two twitch and let it go. That is less aggressive, but defined by patient also. Touch base with them and ask them, look, uh, pain receptor for each one of us are different. You can do multiple release of creating that muscle twitches. Uh, this is really good for pain related to sport athlete, or even someone have had severe pain sore spot. When you palpate the area, it should be tender and tightness. That's where we're looking for that tender spot. Needle go in. It usually twitch. When it twitch, that means because when the muscle are weak, it's become tight. That's unable to finish the conductivity of the exponential energy for the electrical pulses to complete. So it locked up. So what needle does, needle touches that muscle. It's shortening the conductivity, create that excitation, and then it complete. It create that twitches. When it twitch, muscle relax. So that can create very sore or very painful. Those who cannot withstand that release, we call aggressive treatment or rapid release scar tissue, the release trigger point. It's it's defined by individual. So yes, it can be painful. If someone walk in for the first time, we usually do because stationary treatment. Stationary treatment will help a lot. And then following the second session, you know exactly how that patient can withstand the treatment. So technically, it can be as simple as putting patient to sleep. We can treat that way, or we can treat uh, uh, with very strong stimulation, but the recovery a lot faster. Also, I've seen that direction. You can use hand stimulation or electro stimulation, and that super beneficial.
So I guess adding those adding the electric stimulation and the rapid release can be, I guess, intense at times. But the good thing about it is that you see recovery so much quicker. But
Yep.
I guess that's not to say that pain management can be treated without going to those extremes. You know what I mean? Like, do you have a solution for each type of patient depending on their pain tolerance, or how do you go about someone who expresses high pain tolerance versus low pain tolerance?
So basically, we when looking at that, usually some folks would say I have super strong pain tolerance. So the initial insertion of the treatment ideally will tell how the person respond. So if they scream right away, I know that that pain tolerance is not there for that particular patient. So they can say that at the same time, they react right away. If I know that if they react that way, then I will stick with gentle treatment, basically gentle relaxation. It's the treatment should work as as well as aggressive treatment. Aggressive treatment meaning release trigger point, stimulate a little bit more. It worked well with athletes, and they because their body is already in that beat up zone. Sometimes they don't feel that much. They like that muscle to be released. When you that release, you feel so good. Like, oh, it's aggressive, but it's good. For those who really like gentle or afraid of needle, we approach that way too. Just stay. We call stationary. To my way of treating is that having you lay down, insert needle, let that needle work itself, and then within 35 to 40 minutes, that's when needle remove, and that will see the difference as well. Again, people with myalgia, multiple myalgia, people with osteoarthritis, people with rheumatoid arthritis, uh, pe- people with fibromyalgia, they cannot take aggressive treatment. That does require a lot of circulatory improvement, in turn, help unbinding the pain receptor that is the histamine from the inflammatory region or joint or bone. So definitely we have to approach that. Or people with very deficient uh, physiology, the fatigues, dysautonomia, or chronic fatigue type of patient, you cannot treat them aggressively. You can put them in a really bad recovery. Basically, they will recover, but they will pain for some time, at least 48 hours, 24 to 48 hours soreness, and then it recover. Just that we look at the deficiency or the effects of patient that having this issue, we have to be considered.
Got it. And we have another question from the chat. It says, at my age right now, I wish I knew how important treatment was for my body. I did a lot of sports in my youth, and my body hurts now to even move. What advice do you have for young people for maintaining health and how to stay fit until their later years of life?
I'm gonna take this, and Marvin, go take it. Take this one.
Yeah.
I'll add on my side.
Okay, so for young kids, exercise is really important for kids. It helps to stay active, physically, also mentally. So, I mean, as myself, I used to participate in swimming team when I was a kid. So I do a lot of a lot of different routines, a lot of training, whether it's in the pool, whether it's in dry land. So it's definitely a good lesson for for all of us. Like as we were kids, it's all about like learning how to read our body, but also try to understand, the between the win and the lose, and how competition works, and how it can reflect in real life problems too. So kids have to be more active these days. Try to get try like different exercises, get them into different routines and different different workouts. Get them to try different sports as they can if they are capable. People want to be stronger. They can always eat more or strengthen it. Or if that person loves to run, they can focus on their endurance. They can train more on focus on their legs more. So there's so many different like possibilities that they can try out. So it's definitely no wrong answer. It's definitely just see what fits for you for that specific sport. See if that kid's likes it or not.
So from my
yeah.
takes, I would think that for youth or kid or adult, so listen to the body. A certain sport, when a good example, I've seen patients that come to me. I said, please don't do lunging, don't do squatting. That could exacerbate the posture or the area of the hip flexor and all that kind of thing, causing sciatica. Doesn't matter what you in what type of sport. Listen to the body. When the body said there's a pain, it's telling you that there is something wrong there. Get it checked, get it corrected before it become a chronic condition. Chronic condition, it's very hard to correct it. So yes, every sport will, no matter what you like, you enjoy it. But sometimes we say, like good example, Marvin said that he enjoys swimming, strengthening, training on land or in the water. But those are repetitive type of condition. Sometimes you swim when your body is not warm enough. Jump in the pool. You know what? that muscle cramp up. When you swim, you're gonna feel the soreness and stiff and tightness. And when that happens, you get it checked out and get it informed, saying, "Hey, you know what? After I jump in this, I just got out, and then my shoulders start to pull. I feel it's not normal. Get help. Get ask questions." So here we are, healing your way. We have all kind of modality that can benefit all those. We prep athlete before you go into a active roster. We prep anyone that having injury that ready for the season started, whether from kinesiology, from trigger, from acupuncture, from mind body, or from hypnotherapies, or with the PT. So we're here. So basically, listen to the body and get energized and come to see us.
Yeah, I definitely think kids don't pay attention nowadays, or they don't really know that they need to pay attention to their bodies and try to notice things if they're off and feel themselves out, because sometimes they may have an injury occur, but then they brush it off or continue training, and then years later down the line, something so minor has developed into something severe or chronic, and that could have all been avoided if they just spoke up, talked with their parents, came to a clinic like ours at Healing Your Way, where we have so many different practitioners that can help with whatever issue that the kid has, and really just set them up for their short-term future and also their long-term future, by just giving them the help that they need. And that's why I think the person in this question was trying to trying to ask, like, how come their body hurts now, even though they were kind of active as a young person, and like what could they have done to um, uh, alleviate this while they were a kid, and also give advice to kids now so they don't end up like kind of old and non-mobile. So I think it's good that you guys had to speak up and get help right away, and go find people like our practitioners who can give you some real good help. And with that being said, I'm gonna move into one more question before we wrap it up. Um, the question is, I have some confusion with how to treat a new injury. Um, it used to be the RICE protocol that you're supposed to follow, and now I hear that you should alternate between ice and heat. Um, how do you guys approach this? Does it depend on what type of injury that you've sustained, whether you apply ice or whether you apply heat, or would you use both for
So
any injury?
so from that perspective, within 12 hours, usually ice apply first. Ice, because we don't know what happened to the junction or the portion of the body that being damaged. We using ice to slow down the blood flow to prevent further inflammation of the site. So it frees it up. So if something pops, something damaged, it's freeze. That first 12 hours. In order to engage the blood flow, you should do heat, but wait after that 12 hour. So 12-hour rice technique is correct, but after, you should engage with heat. I usually suggest that heat, ice for 5 minutes and then heat for 10 minutes if someone have that type of acute condition. But after that 12-hour entering into 24-hour, the best way is to have heat therapies. So most of the time, heat therapy will super beneficial on that department. But be mindful, that's from injuries and all that, right? But from uh, chronic condition, rheumatoid arthritis, fibromyalgia, also osteoarthritis might be benefit from heat a lot, but the other two might cause complication. So yes, acute pain within that 12-hour period, you do ice.
Got it. And Marvin, do you have anything to add to that, or you think you summed it up pretty well?
Yeah, I agree with Dr. Danny. Using the rice method is really great for like acute injuries, is whether it's a sprain or a strain or like some um, something swollen. Yeah, so definitely apply it for 12 hours. It helps really like reduce the inflammation and the swelling, and also helps like protect that area from like certain damage. But after that 12 hours, apply heat, whether if you're feeling sore or feeling stiff or tight. So I would suggest like apply heat before like a workout just to loosen up those muscles and just improve that blood flow. But also you can also use it after a workout too, just to help relax those tight areas, and it will help recover a lot faster.
Got it. And yeah, I think we covered a lot today, especially so much things regarding pain management. We got to know the acupuncture perspective regarding pain management, and also some insights into kinesiology and how kinesiologists approach this. And yeah, I just want to say thank you guys for coming on and talking about this. And I hope you guys liked today's episodes. Please don't forget to like and subscribe to this channel as well as our other platforms, which are YouTube, Instagram, and Facebook. And the handle is at Healing Your Way. And if you are dealing with any of the problems that we have listed or talked about so far in this episode regarding pain management, please visit healingyourway.com or call 215-322-6035 and give us a call, and we'll have someone talk to you about your issues and what's the best pathway you can take in order to succeed and recover from whatever you're dealing with. So please don't hesitate to reach out if you have any issues or if you're seeking this sort of holistic help, because we definitely have the tools that you need. And yeah, this is What's Up Wednesdays, Professionals of the Roundtable. And thank you guys for tuning in. And we'll see
Thank
you next
you.
time.
Thank you.